Welcome back to another high-yield episode of the Dr. Stem Cell Clinical Revision Podcast. I'm Andrew, your co-host for today's medical board review session.
And I'm Ava. We are absolutely thrilled to have you with us as we break down another high-yield clinical vignette for NEET PG, FMGE, and INI-CET preparation. Remember, doctors, active recall and spaced repetition are your best weapons to conquer these exams.
That's right, Ava. Today we are tackling an essential question from the PSM board, focusing specifically on the high-yield topic of epidemiology study designs. This question is inspired by the NEET PG 2019 PYQ exam, so pay close attention because these concepts tend to repeat frequently.
Let's jump straight into the clinical vignette. Here is the patient presentation, NEET PG Case Study number 34, a clinical scenario involving epidemiology study designs in a patient presenting with high-yield signs. Which diagnostic or therapeutic marker is best used?
Okay, let's carefully review the four options presented to us. Option A is A. Option A, standard diagnostic gold standard. Option B is B. Option B, first-line screening test. Option C is C. Option C, incorrect fallback option. And option D is D. Option D, alternative differential diagnosis.
Now, let's give our listeners a few seconds to think about the presentation. Look at the key clues in the vignette: the age, the onset of symptoms, and the specific diagnostic findings. What is your diagnosis, doctors?
All right, Ava, let's reveal the correct answer and dive into the breakdown. The correct option is option A. Let's start with a comprehensive explanation of why this option is correct.
Exactly, Andrew. The correct answer is indeed option A. Here is the detailed clinical rationale. This represents a high-yield clinical case of epidemiology study designs under the subject of PSM. The gold standard diagnostic or treatment choice is represented by option A. This pathophysiological mechanism directly explains the clinical signs and laboratory findings we observed in our patient. It fits the presentation perfectly.
Excellent explanation, Ava. But as we know, to score highly on the exam, it's not enough to just know the right answer. We must also understand why the other options are incorrect. Let's systematically rule out the distractors. First, tell us about option B. B. Option B, first-line screening test.
That's a very common distractor, Andrew. Option B is incorrect because this condition presents differently. In exams, you'd expect to see distinct clinical signs or diagnostic results that are absent in our patient's presentation. So we can confidently rule this one out.
Perfect. Now, what about option C? C. Option C, incorrect fallback option. Why is this not the correct choice?
Option C represents a different pathological process entirely. While it might share some overlapping symptoms like general weakness or inflammation, it does not match the specific laboratory or imaging parameters described in the vignette. Therefore, option C is incorrect.
Understood. And finally, let's address option D. D. Option D, alternative differential diagnosis.
Option D is also wrong. This is usually associated with a different demographic or clinical timeline, and the key diagnostic hallmarks for this condition are completely missing in our patient. That rules out all three incorrect options.
That's a masterclass in distractor analysis, Ava. Now, to make sure this concept is locked into our memory for the long term, we have a custom study mnemonic. Today's mnemonic is titled Epidemiology Study Designs Review. Let's walk through it.
This is one of my favorite mnemonics, Andrew. To remember the key associations and diagnostic criteria for epidemiology study designs, use this memory aid: Pathognomonic sign key finding for epidemiology study designs, gold standard most definitive test used, management first-line therapeutic choice. Let's repeat that so it sinks in. Pathognomonic sign key finding for epidemiology study designs, gold standard most definitive test used, management first-line therapeutic choice. Try to visualize this clinical association when you see this topic in the exam hall.
Visualizing mnemonics is a proven way to bypass exam anxiety. But wait, we also have to talk about the exam pitfall or the trap that examiners love to set. What is the common trap for epidemiology study designs?
Examiners love to catch students off guard here, Andrew. The major trap to avoid is Do not confuse the first-line screening test, option B, with the gold standard diagnostic test, option A, for epidemiology study designs. Make sure you read the questions stem carefully to distinguish between these closely related conditions. Don't fall for this classic trap.
That is a golden tip, Ava. Thank you for that detailed breakdown. Doctors, make sure to write that trap down in your revision notes.
Absolutely, Andrew. And that wraps up today's high-yield clinical review. Thank you for tuning in to the Dr. Stem Cell Clinical Revision Podcast.
Be sure to subscribe and follow our show on Spotify, Apple Podcasts, or Amazon Music. Share this episode with your fellow medical aspirants, and keep studying smart. We'll see you in the next episode.
Goodbye for now, doctors, and best of luck with your revision.